Hi everybody, this is Dr. Ianello at the North Isle Wellness Center, and I'm sitting here with Carri. Carri and I have been working for a little while to help her to strengthen her female system, help her with getting her cycle back on schedule, getting her ovulatory cycle in, and eventually she wanted to be able to conceive a child. So she's just come in today, and she gave me some very exciting news on Friday. What was the news, Carri?
That I'm pregnant.
That she is pregnant. That's awesome. We're so excited here. So tell everybody what made you come here and where did we start and what did we actually achieve with you in the time that we've been working with you?
Well, after I had gotten married, it was a year in November. My husband and I wanted to start trying, and after I got married, I stopped getting my period for some strange reason.
Okay.
The midwives that I went to suggested a fertility specialist. I had some blood work done, and there was an issue with my thyroid, they thought initially. I was later diagnosed with polycystic ovarian syndrome. The first thing the fertility specialist wanted to do was put me on Clomid, and I didn't want to go the hormonal drug route right away, so I asked if there were any other options. He suggested a dietitian. I asked around at work, and a good coworker of mine had recommended Dr. Ianello.
Terrific. So you came in here, and initially, now I remember her complaints were her ovulatory cycle was off, her menses was gone, and she also had back pain. And I thought that was interesting because what I explained to Carri is that there's many different reasons why sometimes a woman's body doesn't do what it's supposed to do. You have to look at it wearing many hats. Now, I have a personal experience in this type of situation because many years ago my wife had the same problem, and it was because of just pure chiropractic care that we were able to get Nadine's cycle back, get her pregnant, and have children. So when Carri mentioned she had back discomfort, I said that's an issue because the nerves that come out of your lower back go to your reproductive organs. So how do we know it's not nervous system stress that's causing you not to have your cycle? So we started handling that as well because I felt that was a factor. And it actually showed up on nutritional exam that it was a factor. Then taking off the chiropractic hat and putting on the nutritional hat, when I initially did an evaluation on Carri, in nutrition response testing, there are two neurological tests that have to always be clear for the patient to heal. And I remember when I met Carri, she had one test that was positive for not allowing your body to heal. We call that blocking. And Carri started off on the table block to healing, which means the things that you wanted to work on, whether it was to try to get your cycle back and get pregnant or anything else, weren't going to work. So when we started with Carri, I said, Carri, we've got to first fix this one level. And then once we fix that level, then your body will open up and start healing. And I remember we went right into wheat germ oil with you.
Yes.
Now, why wheat germ oil? Well, because wheat germ oil is a pure vitamin E quality supplement that's been known to drive fertility. And Carri's been religiously taking wheat germ oil for, I don't know, like a long time now. How long? Like 11 months?
Yeah, 11 months. Yeah.
I mean, she started with me about 11 months ago not having a period at all to now having a period. And she's been tracking. She did a great job of tracking her ovulatory cycle. She actually was taking her temperature. She knew when she was ovulating. She knew what day she was ovulating. And month after month, it got better and better and better. I said, Carri, just keep going, just keep going. And I kept adjusting her back to make sure that her nervous system worked well. So got to take my hat off to you. Consistency. This girl has been consistent, never missed appointments, never missed a nutritional work. Hit it. And she goes, is it ever going to take? I'm like, yes, we just have to keep going because her body healed itself.
Yeah.
And here we are now. She texted me on Friday. And I got the text in my kitchen, and Nadine, my wife who works with me nutritionally and has worked on Carri's case, Nadine literally is screaming, you can't text it, give me the phone, I want to talk to you. We had so much fun because of your good news.
Yes, good.
And this is a really big deal. I mean, this is somebody who did it completely naturally, no drugs.
Right.
She was really, and not to mention her energy came back.
Yes,
she lost, I think, about 10 or 15
pounds. Yeah.
Because she said, everything she wanted. She wanted to get her energy up, her motivation up. She wanted her menstrual cycle back. She wanted to get pregnant, and she wanted to, and her back pain's gone.
Yeah.
I mean, I can't find anything wrong with her anymore, which is exactly where we want.
Right.
So now, going forward, now our goal is we're going to help her with a nutritional protocol that's specific for an expecting mom. I'm going to pull that out for you and go over that with you. We're going to, continue to monitor her and help her body stay strong, and she's going to continue doing what she's going to do. And I know that in 10 months we're going to see a little bouncy baby.
Yep.
So we're kind of excited in here today because this is something that we worked on, for quite a while.
Right.
So I'm very proud of you. Do you have anything else that was relevant to what you did that made you feel better, or?
No, it was easy as long as you follow the Dr. Anello and Nadine's instructions. They lay it out very clearly for you. There's no guesswork. It was a great
I
process.
know, I really appreciate that, and we're tickled pink. We
Yeah.
really are. So again, congratulations. I'm so proud. So again, if you're having an issue with female issues, or especially terribly infertility, your body will heal itself when you give it what it wants, and Carrie's a walking example of that. So 10 months time, the little baby will be on her lap. We'll have the other video we'll show them. Okay, we'll talk to you soon. Take care. Bye bye.